Had my sister come home from ICU on a ventilator with tracheostomy, long-term ICU care at home with intensive care at home. My name is Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, home care for BiPAP, CPAP ventilation without tracheostomy, tracheostomy care without ventilation, home TPN, home IV potassium, home IV magnesium, home IV antibiotic infusions, central line, peak line, Hickman's line, port management at home, cough assist management at home, ventilation weaning at home, palliative care, as well as PEG, patch tube, nasogastric tube, and nasojejunostomy tube management at home. So today I have a question from Elizabeth, and thank you so much for sending through this question. And Elizabeth says, "Hi, Patrik. Now that my sister is stable in ICU, but she's still on the ventilator with the tracheostomy, where do we go from here concerning her care? They think she's going to need long-term ICU care, but I want to take her home instead." And as for the tracheostomy collar or the tracheostomy mask, I was hoping they would have started trying to use it by now, but they need a doctor's order, and I've asked for the doctor for a couple of days now, but I haven't seen any. Since we've started a new week, I'm hoping to see one today because I'm going to ask again. Thank you, and I look forward to hearing from you, Patrik, what the next steps are to take my sister home with intensive care home from Elizabeth. So thank you so much again, Elizabeth, for your question about getting your sister home from ICU, even though she's still on the ventilator with tracheostomy. But that's exactly what we do at intensive care at home, and I'm going to walk you through the next steps right now. So why long-term ICU care at home makes a lot more sense. First of all, when the ICU team tells you that your sister is going to need long-term ICU care, what they really mean is that she needs ongoing ventilation support and monitoring with a tracheostomy. And here's the thing, you don't need to keep your sister in the hospital or in ICU for that. Long-term ICU care can absolutely be provided at home, and here's why that's actually much better. It's generally speaking better outcomes. Patients recover faster at home in familiar surroundings, lower infection risk. Hospitals are breeding grounds for superbugs and infections. Family involvement, you can be there 24/7, not just during visiting hours. Quality of life. Your sister can be in her own environment with her own things. There is no quality of life in an ICU where it's noisy, the lights are on almost 24 hours a day, and where there's infections everywhere. And intensive care at home is by far more cost effective than an intensive care bed. Home care is significantly less expensive than ICU care. ICU bed costs between $5,000 to $6,000 per bed day. We can provide that at home for half of the cost. And again, we're freeing up much needed and in-demand ICU bed. So let's look at the tracheostomy collar or tracheostomy mask process and what you need to push for. You're absolutely right, Elizabeth, to be pushing for them to start tracheostomy collar trials. The fact that your sister is stable and has a tracheostomy means she might be ready to start the process. So number one, what you need to do, demand to see the ICU doctor. You've been asking for days. That's not acceptable. Tell the charge nurse that you need to speak with the attending ICU doctor today about starting tracheostomy collar trials and find out what ventilation settings is she on and how far away is she from starting tracheostomy collar trials. Be polite, but firm. You think that your sister is stable, she has a tracheostomy, and I need the doctor's order to begin the tracheostomy collar trials immediately. When will the doctor be available to see me today? But what you also need to do is you need to get access to the medical records, because once you have access to the medical records, you can also communicate with us can communicate with us, and we can help you interpret ventilation settings and when she can be on the tracheostomy collar. So, and they can start with short intervals. Tracheostomy collar trials typically start with 5 to 10 minutes initially, gradually increasing to 15 to 30 minutes, then 1 to 2 hours, building up to longer periods. The ICU team should be monitoring her oxygen saturation, respiratory rate, and comfort levels during these trials. Document everything. Keep a notebook and write down when a tracheostomy collar trial starts, how long each trial lasts, how your sister tolerates them, any concerns or improvements you notice. This information will be crucial when we transition her home. So let's look at next steps to get your sister home with intensive care. Elizabeth, here's exactly what you need to get your sister home from ICU. Go to intensivecarehome.com and give me a call. Get me a call us on one of the numbers on the top of our website. We're going to assess your sister's current situation, review her ventilator settings, tracheostomy care needs, ABGs, arterial blood gases, discuss your home situation, create a customized plan to get her home safely. We'll handle the complex coordination. Once we start working together, here's what intensive care at home takes care of: medical equipment, ventilation, suction machine, oxygen, monitoring equipment, hospital bed, etc. Home nursing, ICU nurses who specialize in ventilator and tracheostomy care at home, ongoing ventilation and weaning protocols, training. We teach our nurses how to look after your sister, has to be individualized, and 24/7 support. You're never alone in this journey, right? And we coordinate with your sister's ICU team to ensure proper discharge planning. All equipment is in place before she comes home. Nursing staff are scheduled. Emergency protocols are established. Follow-up care is arranged. And, we can continue ventilation weaning at home, including mobilization. You haven't mentioned anything about your sister getting mobilized and getting out of bed, because that's absolutely critical. Home ventilator weaning is often more successful because patients are more comfortable and less anxious. Quality of sleep improves dramatically. Familiar surroundings reduce stress. Family support is constant. No hospital-acquired infections to fight off. And tracheostomy collar trials you're pushing for right now are at the beginning of this weaning process. So, the reality about long-term ICU care, when doctors say someone needs long-term ICU care, what they really mean is they need ongoing ventilation and tracheostomy care and support. They need monitoring, and they need ICU nurses 24 hours a day, and all of this can be done at home, of course. We've helped hundreds of families by now to bring their loved ones home in exactly this situation, whilst being stable on a ventilator with tracheostomy. Also, here might be common objections you might hear from the ICU team. The ICU team might tell you she's too sick to go home. If she's stable, she's not too sick, she just needs the right support at home with intensive care at home and our critical care nurses. They might even say you can't manage a ventilator at home. Well, you absolutely can with proper ICU, 24-hour ICU nursing support. We do this every single day and have been doing so for over 12 years now. So what if emergencies happen at home? We have protocols in place, but more importantly, we have the staff in place to manage this, and our nursing team is trained to handle these situations. And if the ICU team tells you that no one will be paying for it, well, that's not true. We wouldn't be in business if the insurances or NDIS or other funding bodies won't be paying for it, because it's half of the cost than an ICU bed. And, the funding bodies actually prefer that. So your sister deserves better than warehousing. When hospitals talk about long-term ICU care, sometimes what they really mean is, that they don't really know what to do next. But the good news is we can do that at home. So your instinct to bring your sister home is absolutely right. And what makes intensive care at home different? Well, we're just not any home care service provider. We specialize in complex ICU cases at home. And I've worked in intensive care and critical care nursing for over 25 years. And I've seen firsthand what works and what doesn't. Our track record speaks for itself. Successfully transitioned many, many clients, adults and children, on ventilation and tracheostomy at home. We manage complex tracheostomy care at home, achieved ventilation weaning and tracheostomy weaning at home. We're preventing ICU readmissions, and we give families their loved ones back. So Go to intensivecareathome.com, call me there on one of the numbers on the top of our website, and don't wait, because time is critical. Again, your sister is at risk of hospital-acquired infections, ICU delirium, muscle wasting, depression, anxiety, complications from immobility. And given that she's stable, that means she's ready to start the journey home right now. Now, with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. We are providing the following: home care services for ventilated adults and children with tracheostomies with critical care nurses 24 hours a day. A genuine alternative to a long-term stay in intensive care or long-term acute care. Tracheostomy care for clients without ventilation. Home care services for patients on non-invasive ventilation such as home BiPAP, home CPAP. Home TPN, which is also known as IV nutrition. Home IV potassium and home IV magnesium infusions, IV fluids and IV antibiotics. We are providing central line management, PICC line management, Hickman's line management, as well as port management at home. We're providing nasogastric tube and PEG tube management at home. The use of cough assist machines for our clients for airway clearance at home. Palliative care services at home, as well as ventilator weaning at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day, and we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life is much improved surrounded by families and by a team of dedicated intensive care nurses in the home care setting instead of in an intensive care unit. With intensive care at home, we are currently operating all around Australia in all major capital cities, as well as in all regional and rural areas. We work with NDIS clients all around Australia, TAC and WorkSafe in Victoria, Department of Veteran Affairs all around Australia. Our clients and we as a service provider have also received funding through public hospitals, private health funds, as well as departments of health. We are having policies and procedures for intensive care at home nursing, and we've built all the intellectual property for intensive care at home since 2012. No other provider in Australia has created more intellectual property when it comes to intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. So if you're at home already, and if you're watching this, or you're stuck in an ICU long-term, or if you're going to hospital and ED all the time, and you realize that you don't have the right level of support at home, or if you are stuck in an ICU, I'll give you a real-world example today how we can help you. One of our first clients when we first got started in 2012 was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after a client at home on a ventilator with a tracheostomy. That is dangerous and it's simply negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with a cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at high risk of dying if they don't have a team of dedicated critical care nurses looking after them 24/7 at home. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. Think about it. In an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment in the community? So this client at the time found out about us eventually, and the ICU that he was basically living in also knew about us and eventually reached out to us. And we were proving our concept with this client very fast when we worked with this particular client We sent him critical care nurses 24 hours a day, and he never ever went back into ICU ever again, as long as we were working with this client. We can do the same for you if you're not safe at home and help you with keeping you at home predictably. Otherwise, we would not be in business. Again, the same is applicable for those stuck in an ICU, similar to this case study that I've just given you. Or if you're going back to ED all the time, please reach out to us. We can help you with taking you through the right steps, including how to get funding with different funding bodies. This is also why we are providing NDIS support coordination. We have a team of NDIS support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDIS support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCodder. If you're an NDIS support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you need more evidence for nursing care, we are also writing NDIS nursing assessments with legal nurse, critical care consulting nurses. If you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined. You can join this high-performing team if you are a critical care nurse. If you are looking for a career change as a critical care nurse, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again because they are so vulnerable and so special. That's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts and you're really keen on building solid relationships with us and with our clients. If you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients, or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is so much more cost-effective than what you're paying for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, or for home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US and in the UK, and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.